listeners. It is my pleasure to introduce our first panel, Enhancing Interactions with Families When You Don't Speak Their Language. In pediatric care, communication is at the heart of everything. This panel will explore strategies for engaging multilingual families, building trust across language barriers, and promoting early relational health. Our panelists will also introduce a new Reach Out and Read resource, a one-pager with practical tips for supporting relationship-centered care during well-child visits. And now I'm excited to pass it on to our wonderful moderator, Dr. Nikki Shearman, who will lead today's discussion. Nikki, take it away.
Thank you, Jessie. We're delighted to be here. We have a wonderful panel that are going to be talking about this new Reach Out and Read directive, enhancing interactions with families when you do not speak their language. Now let's start with Perri and Leora. Would you tell us the background and the experiences that prompted this work? Let's start with Perri.
Hi, I'm Perri Klass. I'm a pediatrician. I work in New York at Bellevue Hospital. I teach at NYU. I'm the National Medical Director of Reach Out and Read. And I just want to start by thanking Jessie and the Greater New York Reach Out and Read for supporting this work, which we're going to talk about, and these conversations, because as I think you'll probably all understand, where should these conversations happen if not here in New York, with its history of welcoming and including people from across the world, and with its history of being enriched by the cultures that people bring, including the parents, grandparents, and selves of many of us in this Zoom room. So Nikki, do you want me to talk, or do you want the others to introduce themselves? Do whatever you tell me.
We'll introduce everybody as they join the conversation. Okay. So fire away.
So I'm going to start as a pediatrician, as the National Medical Director, by admitting to you that this conversation comes in some part out of a repeated feeling that I have in the exam room with families, that I'm not doing the job as well as I wish I were. And that even though my heart is in Reach Out and Read as much as I think it could be, and even though I've got a lot of experience and I've been doing it for a long time, that there are repeated episodes when I'm in a room with a family and not only, and we don't have a language in common, and I'm not fluent or even close to fluent in the language that the family speaks. And I feel that I haven't done my best by the child, by the book, by the family. And I come out of the room thinking, how could I have managed this more skillfully? So it comes out of that question, talking to colleagues and friends whom I trust, and them talking to me about what can we do that would really work, and coming to terms with the truth that some of the advice that we learn in medical practice about how to work with families who speak other languages needs to be tweaked a little when it comes to literacy promotion. That is to say, I've attended many seminars that have taught me over and over again not to trust my own faltering attempts in a language where I'm not fluent. I need a medical interpreter who's really well trained, not to go through a family member, use the medical interpreter, don't put family members in the position of interpreting, don't rely on my own inadequate version of the language. And, all of this good, important advice to reduce medical error and to make sure that families get the best medical care we can possibly provide. But it's not necessarily about literacy promotion. And what we've been talking about and what we want to talk with you about is the question of, and how do we make all that work around the books and the anticipatory guidance and the modeling that we do and Reach Out and Read. Let me pass it back.
Thank you. Let's pass it straight on to Leora. Leora, tell us about yourself and tell us about some of the experiences you've had that have led to this directive.
So good morning, everyone. My name is Leora Mogilner, and I'm a pediatrician at Mount Sinai in New York City, and I'm also the medical director for Reach Out and Read of Greater New York. And a huge thank you to Emily, to Jesse, to Kari, to everyone at Reach Out and Read. And I don't want to mention everyone because I'm sure I'll leave someone out, but I really appreciate all your efforts in putting this meeting together today, and in working with us on this specific issue. Going off of what Perri was saying, I think a number of us were sort of frustrated, as Perri was mentioning, feeling that there are best practices, there are guidelines that hospitals, that medical centers put out on best practices for use of an interpreter for delivering medical information. But when you're trying to forge a connection with a family, when you're trying to build a level of trust, and then model for parents, right, how they can use a book with their child, how they can promote their child's early relational health, show them how they are their child's first teacher, it's really hard to do that when you're talking, when you're not getting to their level and maybe using some words in their own language, and when everything is through an interpreter. So a few of us got together and said, we can do this better. We're not by any stretch trying to upend the best practices, but understanding that when it comes to pediatric primary care, and when it comes to promoting parent-child bonding and early relational health, there are definitely, I would say, enhancements and additional things that we can do that really build a stronger relationship. I will even say, my own experience, when I was in medical school and even during residency, I was taught, there are certain questions you don't want to get too personal. You don't want to ask about, or even more recently, what country someone is from, or what languages they speak at home, or who's speaking what languages. And, it always puzzled me because of course that's what I want to know. I think that allows me to connect with a family so much more deeply and understand how many people in the family are speaking different languages and really celebrate that. I mean, I tell families the fact that you have 3 different languages in your family that people are speaking well, this is the time to speak them to your child. And this is how your child's brain develops. So I think really celebrating the richness of the cultures and the diversity that our families are coming from is something we can do. And how do we do that? How do we do that through an interpreter? And these are conversations, that we are having with our families, that we're having with each other, and hopefully we'll be able to give some advice about how to do that. I'll give one example. Perri reminded me of earlier. We have a lot of families from West Africa in East Harlem, and I'm fascinated by the profusion of languages that families are speaking. Families are speaking French, but they're also speaking their own dialects. And when I go into a family and they tell me they're from Cote d'Ivoire or Gambia, and I can say, oh, do you speak Bambara or do you speak Mandingo? And they look at me like, oh my God, how did you know that? That's amazing. So I walked in this family and the name, was very similar to the name of another family. I said, oh, do you speak Bambara? And they said, you speak Bambara? And I said, no, I don't speak I don't speak Bambara, but you do. And that's amazing. And you should speak it to your child. But just understanding that people come from rich cultures and they shouldn't be ashamed, and celebrating that. Those are things that I think aren't really in the textbooks. And maybe, if you look at the textbooks, they're saying don't get too personal. I would really beg to disagree with that.
Thank you, Leora. And then let's move to our third panelist today, Claudia. Do you want to say a little bit more, and then actually maybe start moving on to what are some of the general advice and ideas that are included in this document? Claudia. You're muted, Claudia. Still muted. Oops.
Apologize about that. Good.
We think we're jumping backwards and forwards, Claudia.
Me.
There, we can hear you. Good, we're good.
Now I got it. Sorry about that. Thank you, everybody. Good morning. It's a pleasure being here. My name is Claudia Aristy, and I'm the director for the Reach Out and Read program at Bellevue Hospital. But I'm also a mother of a now an adult who received his first book from Reach Out and Read. So I can speak both professionally and personally about what this work means and the impact the program has on the lives of so many families. And I can also speak about the difference it made for me and my child going into the Bellevue Pediatric Clinic and encountering a doctor who had a really warm approach and welcome us into the clinic as a new migrant into the city that was so different. There were so many different complexities in terms of culture, language, food, so many different things that I had to adapt to. And receiving that welcoming disposition from my doctor made me really feel part of a bigger family. And that can make a huge difference. So in my work with the families at Bellevue, where we have so many families, mainly Spanish speaking, but also from different parts of the world, I have seen that the families are looking forward to coming to the hospital, not only because they're getting the medical care for their children, but because the doctors are recognizing that the well-being of their children is, we have to make sure that the well-being of the parents is addressed, and in a way that the parents feel that we're seeing them, hearing them, and paying attention to what their needs are. And even when you don't speak the same language, just walking into that room with a smile, as Perri and Leora mentioned, and trying to acknowledge the person who you have in front of you, the country where they come from, and showing genuine curiosity about who is your patient, who is there in that room, acknowledging the present and the rich culture that they bring, can make a huge difference in how they proceed to establish a relationship with you. A relationship that we hope can be of trust, because we know when there's trust, it's very different than when they're coming into that room with fear, or into that room with not knowing if they can really speak about the reality that they're confronting in their family, the challenges that they're confronting. So in my 24 years working at Bellevue, I have encountered so many families that have said that just having someone who greets them even in the language, or ask them about where they're from, makes them feel welcome. And I can speak as a parent, I can speak from my work also, working with the residents, because at Bellevue Hospital, the majority of our providers are resident, and how we help support their work, because we acknowledge it's challenging for them as well when they're working with families who have so many needs, and the language can become a barrier. But we don't want to see the language only as a barrier, but as something that books have a common language to themselves, a beautiful common language that we want to let the families know, and encourage them to use the books with their children in the language that they speak. And we work hard in Reach Out and Read in trying to provide the books in that language that the family speak. But even when they don't, then teach them some strategies and role models, how to use the book in their language, and how through the use of the book, they can also talk about their culture, their music, and all the wonderful things from back home in their country, which should be celebrated in a time when maybe families are not feeling welcome and celebrated. So I'm happy to be here with all of you and to be able to expand this conversation a little bit more.
Thank you, Claudia. Right, so let's get down to brass tacks here. I believe that Carrie is going to put the link to this new document in the chat, and also just going to bring up a slide just so that you can have a quick look at it. We're not going to work through it, but it's just to give you a, here you are, new, beautiful new document, enhancing interactions with families when you do not speak their language. And then with some special highlights there that we're going to talk through now. So I think it was going to be put in the chat. Whatever, if it's not in the chat now, there you go. It's in the chat. You can take a look at it while we're talking. The information will also be sent out in the follow-up to this conference today. Okay, thank you, Carrie. We'll just go back so that we can see all the faces of our. So let's talk about what do you say in this document? Perri, do you want to tell us some of the details about what you're recommending we do generally?
Sure. I think, as I said to you earlier, I've been to a lot of seminars on trying to do our best to deliver good medical care across language barriers. And they've been useful and they're important. And I've learned to be incredibly grateful for the good medical interpreters, whether they're in the room or on a screen or at the end of a phone. They help us do what we otherwise could not do. On the other hand, in all of those seminars, nobody ever said to me, "Hey, doctor, why don't you try making a little bit of a fool of yourself? Why don't you be a little silly?" Don't think of the convention of the medical interpreter as this person is here because you, the patient, don't speak English. The person is here also because I, the doctor, don't speak Vietnamese, don't speak Bengali, am not fluent in Spanish. The person, let's come at this as you've got a rich, amazing language that I don't speak. Could you teach me a little of it? Can I admire it? Can I admire the way you and your baby can communicate in that language? This is about using language to connect you and your baby. Can we use it in some way together? It's fine if if you and the three older children are all amused by my inability to count to 5 when you try to show me how in your language, right? Let's have some direct communication. Let's use my inadequate efforts in your language to greet you, to admire your child, or maybe they'll impress you. Maybe I'll surprise you by the fact that with all my inadequacies, I can count to 5 in Bengali. But can we connect directly around the baby, the book, and the power of language to communicate, and still respect and use the skills of our interpreter?
Thank you, Perri. Do you want to add on, Leora?
Yeah, I was just going to say, because some of this is not, I think when, those rules or those guidelines for use of interpreters were created, it's really not specifically looking at pediatric primary care, and definitely not with the focus on the modeling and the demonstrations that we try to do for parents. And I think so much of what we're trying to do in primary care in general, and specifically with Reach Out and Read and promoting relational health, is the modeling and the praising, modeling for the families and then praising what we see the parents are doing or what the child is doing. So one tip, I think, is just so if you're using a phone interpreter or a video interpreter, just giving them a heads up and saying, this is what I'm going to be doing. And maybe they don't need to comment on every single thing, but just explaining to them, I'm going to be showing the parent, or we're going to be doing this, or I'm going to be reading a book with them, and I'm going to be showing this to the child, just to give them a heads up if it's a phone interpreter, so they have a concept of what's going on. It's easier when it's a video interpreter. But clearly these guidelines were not, I think, constructed with that modeling aspect in mind. And then I think being able to communicate with a family, even if it's just knowing how to say happy birthday or count to 5, just showing them an appreciation for their language is huge. And when I can go into a family and say a few words in Arabic, or say, hey, this word sounds like that word, it really goes a long way towards building that bridge. Like, I respect your culture. I think this is really cool. Again, like Perri was saying, doesn't mean you don't speak English. I don't speak Arabic. So it doesn't, there's no value judgment there. We're really all trying to just get to a common ground. I do want to specifically mention, Nikki, when it comes to the modeling, which I think is so important. And I will say, for many of my patients who come from cultures where they didn't have books for babies, or maybe they were too expensive to purchase, or they weren't, printed in their language, I think it's really important to show them how to, model for them what to do with the book. And it's really okay if the baby, we want them to put it in their mouth or to explore it or to hit the pages. And, that 9-month-old or 12-month-old is not going to sit still while you're reading a whole story. So I think that's really important. And being able to do that in the context of the visit explaining to the interpreter what you're doing, I think is really, really important. I also think I just want to, and I think Claudia alluded to this, we try to give out books in different languages. We clearly don't have books in every language. So we have in many, and we have, I mentioned West Africa. Many of our West African patients do speak French, but some of them don't, and some speak languages. So I really just want to, reiterate how important it is. I tell parents, you don't have to read. And many of my patients, by the way, who speak English may not feel comfortable with their own literacy level and their ability to read to children, especially as their kids get older. So I always tell them, you don't have to read the words on the page to have a meaningful experience with your child and books. You can make up your own story. You can make up a different story every single time. It's really about looking at the pictures together, about the language that you're exposing your child to, and even more important, I think that bonding and fun experience that the parent and the child are having together. And I think that's something that you can explain to a family, you can show them, and you can also explain to them through the interpreter, because I feel like parents sometimes feel, I'm not going to do this well, and if I can't do this well, I shouldn't do it at all. And we really want to dissuade them from doing that. And again, you can have, and in those situations, I try to get books that have fewer words on a page so parents aren't as intimidated. There are wordless books, but even if a book has a lot of text, make up your own story. It doesn't really matter. I think it's the language. It's about the richness of that interaction. So I'll stop there. I think I will say one, maybe I won't stop, but I think, I recently did a training for our residents last week about, how to promote early relational health. And is it okay if I mention the document that National has put? There's an amazing document that's, I think, under review right now that is going to be, that's going to be disseminated. That will be a really handy, easy to use guide for clinicians in the exam room at different visits. So if you think about our Bright Futures materials, it's going to be, and I'm probably not giving all the details correctly, but laminated, and it'll be really helpful, useful tips that clinicians can use with families for kids of different ages. And it has information about developmental assessment, anticipatory guidance, and modeling, how you can model and what's appropriate for different ages. I can say I gave my residents a preview last week and they loved it. And I think it'll be really easy it'll make things a lot easier, I think, especially for trainees as they're learning. And even it's great, for clinicians at any stage of development. But I think just reminding us about the importance of modeling, of making that connection. And it's not just modeling, it's also, letting your guard down, being silly, showing, what you can do and respect families for their, for their cultures and for their abilities to care for and connect with their children.
Thank you for the ad, Leora. She's talking about a new document that's called Books as a Clinical Tool that Leah on my team at National has been developing together with our group of clinicians who help guide us. And that will be ready for dissemination a little later this year. And we'll talk more about that then. Claudia, do you want to talk about sort of general instructions around enhancing your interactions with families when you can't speak their language?
Absolutely. I mean, two things come to mind. One is I want to emphasize some of the things that Leora just said in terms of modeling, because I have seen it again and again, how families really walk away remembering what they see you doing, not necessarily what they hear you saying. And also how you make them feel. I think we all as humans are looking for people who validate us as individuals, who validate us, especially as parents. A lot of our parents are feeling right now like are questioning, wondering, am I being a good enough parent? And in whatever language they speak, being able to praise the parents for the amazing job they are doing, I think that speaks volume. And I have an example of a mom who walked out of the exam room, and the child, while mom was making the appointment for the next visit, approached me, pulled my skirt, and made me sit down because he wanted to show me the book he just got. He was so proud and so happy about the book. I could see that we were not going to have time to read the entire book, but I proceeded just to look at the pictures, point things, and use the book to play peekaboo and have fun with the child. And when mom came close to me, she said, "Wait a minute, you're not reading the book." And this was an interaction in Spanish. And I said, "We are enjoying the book." So sometimes even reminding parents, because the definition that they might have of reading is very little, that books are for reading every single word, and that it's more important to have those moments of connection and creating those memories that are full of love and full of fun. That those are the things that children will definitely remember. And that for the doctors, as they walk into the room, also, I think a big challenge is the pressure they feel in terms of how long will it take to model this interaction, because they're already pressed for time, and we understand that. But I show the residents, when I have the one-on-one sessions with them, how even within less than a minute, you can get so much more done by using the book as part of the visit, that they can get a lot of the things in their checklist checked off, seeing some of those developmental milestones about what the babies can do, but at the same time, role model for the family on how to use that book in a way that will be conducive to that relationship between caregiver and their babies. And that's really the heart of Reach Out and Read, is supporting these families to develop a strong, positive, loving connections with their babies. The other thing about language is I think it's important for parents to hear that when I'm interacting with a family who speaks a language that I don't speak, I say, "I wish I could speak your language," so that they see that, we value what they bring to the table. And I say, "I might not be proficient in your language, and you might not be proficient in English, but you're proficient in your child. And in the language of love, you are able to talk with your child." And one example comes to mind of an interaction I have with a family from Africa. And this was a gorgeous 3-month-old who was holding up her head, looking for everyone around. And mom told me no English, because she was afraid about how the conversation was going to go. And let me tell you, Nikki, that was the best conversation in the entire day I had with that baby. And mom was smiling, seeing how her baby was reacting to a new phase where it was just eye-to-eye contact, smiling and pointing at the book and saying, because if one thing everybody understands is when you praise the baby, there is something that no matter how much English the families are able to speak, they get that. It's a positive disposition that you have to their baby, and to them. And the mom was like, "Thank you," at the end. And I said, "Don't be afraid to speak, and if also letting them know that if when they're ready, if they would like to learn more about all the resources also for themselves in terms of learning English, or improving their literacy skills in their own language, we're happy to provide that sort of information as well. But that has to happen in a context of trust, where they feel welcome and where they feel accepted and where they feel value for the knowledge that they bring in terms of their own culture and their children.
I just want to add one thing, because Claudia, you literally took the thought out of my head about getting pushback about how much time does this add to an encounter. And I know when I started the Reach Out and Read program years ago, the pushback I got from the attendings was, "Oh, this is going to add on more time." And I think one thing I always tell our doctors, my residents, and I'm a preceptor and I'm a residency program director, if you do this and you incorporate this into your workflow and you feel comfortable with this, this is a time saver. none of this will really add time to your visit. So if you're able to use the book as a developmental assessment tool and as a marker to see how's that relationship between the parent and the child, and to provide anticipatory guidance, it really cuts down on the time that you spend. So I think I just wanted to, you said what I was thinking about, how this does not need to add on time to the visit. And if anything, and not to mention, of course, building trust and all the other wonderful things that we're talking about, but you can really seamlessly incorporate a lot of the modeling in any language, right, into your visit. And it doesn't, because I think whenever we say to, especially to residents, here's a new document, or here's some new, whatever, the first thing is, oh no, you want me to do something else. I'm like, no, this isn't something new. This is just to make your lives easier and give you some tools and some other things for your toolbox that you might not have known about before.
So what we're saying, some of the specifics then that you're hearing that we've talked about, find ways to connect directly, whether it's a greeting, whether it's a way of using the language to say something nice about the child. You can ask the interpreter, how do you say what a beautiful baby? How do you say she's so strong? What's the word? You can ask the parents if there's enough there, if there's enough communication going on. But what else can you do? We're saying model directly, vary your voice, use parentese, oh, there's the baby. Use the language, use the varied voice, and then have the interpreter help you. Explain to the interpreter, especially if it's somebody over the phone, what you're doing, and get the interpreter to help you explain to the parent, yours is the voice that she really wants to hear. She really loves your voice. Or look at the pictures together and talk about them, or tell me about the stories that you tell or the songs that you sing. What does he like best? Engage the interpreter in that conversation so that the parent hears explicitly those positive messages about how important your voice is, how important that time together is, how I see her responding to you. I saw her turn her head when you talked. So we're saying do both of those things. Find some strategies. In the one pager, we suggested getting the family to teach you either the word for dog or what the word they use in their language is for what a dog says. But again, I think, and this is, for me, this is especially important because Claudia talked about working with residents. Leora talked about working with residents. Residents, they feel both so pressured to get all of those impossibly many things on the checklist checked off. They're, worried that you're going to ask them, and did you ask about this? And did you ask about this? And did you find out that? And did you find out this? And we all know that there is no way on earth to get all of those things checked off in a primary care visit. So, but that they feel that pressure. And also, you feel, I think, especially when you're learning, more self-conscious about, being a little silly or acknowledging that you don't speak the language. And, always in the back of your mind, or at least always in the back of my mind, is, oh my gosh, if I were fluent in whatever language, I would be doing so much better job here. I would be the provider this family really needs. I would be the pediatrician of their dreams if only I could do this in their own language without having to go through an interpreter on a screen on a pole. And so I think that they're feeling that even more powerfully as they learn. And one of the things that we can do is model for the residents, as we model for the families, that direct connection, that explicit statement of observation and approval of the parent's importance, those really matter. And that it's not a question of asking the resident to say through the interpreter, please, you should read to him every day and you should point at the pictures and name things. That's an important message, but a little bit of pointing and naming and varying your voice and actual communication in the exam room makes it a more powerful message for the family.
And I want to add one more thing that comes with celebrating that diversity in culture. And it's also pointing out to the families the importance of storytelling and oral tradition, right? That they can tell their folk tales back from back home. Because growing up, for example, I didn't grow up with books. Um, Books came into my life later once I started school, but in the early ages, so it might be something that families are not familiar with, that they have to get more comfortable with. But I do remember my great grandmother telling me stories and telling me folk tales, or trabalenguas or other things in Spanish that became part of my childhood memory that I still treasure a lot. So reminding parents that is yes, that you have this wonderful tool, which is the book, to be able to talk and enjoy time with your baby. But that doesn't mean that that's the only way you can infuse your culture in establish this strong bond with your baby, but that also through singing songs from back home in their own language, introducing those stories that they remember or telling them, making up stories in their own language, that all of that becomes part of the way we want them to be able to relate to the children as well. And sometimes I even ask about special holidays that they celebrate that we don't. So I think there are many different ways in which we can show that genuine curiosity to learn from our patients. I tell the parents I learned so much more from you than you could possibly learn from me. So tell me a little bit about you. Tell me a little bit about what it means for you. What are some of the things you enjoy doing with your baby, and praising them as we have been constantly saying, because I think that's something that parents are craving to hear. It's really, especially coming from the medical community that they respect so much. They want to hear that they're doing a good job, because when they come into the exam room, a lot of times they only hear about the things they're not doing or the things that they should be doing. And I think we need to balance that out with praise for the work that they're already doing with their children and how well they're doing it.
So I would just like to add on to that, and this references some of what's already been said, is one of the things that I think parents may want and need to hear, and this is something that an interpreter, I think, can deliver with real power, is that bilingualism is a superpower, and that this child will grow up to do what neither of us, neither I nor the parent in the exam room, can do. This child will grow up fluent in more than one language. We at the health center where I used to work, one of the things that we said so often that the interpreters actually, I think, started saying it even when we didn't say it, is when your child is grown up, if your child wants to work in healthcare, we want them to come work here because we need bilingual Vietnamese, English speaking doctors, nurses, we need everybody who can do that. But I think explicitly discussing with parents, especially as children grow towards school age, through an interpreter, that hearing one language at home, as long as there's lots of talking, conversation, and storytelling and singing in that language from you, sets up the child with that amazing child brain to do the thing that I will never be able to do, to acquire the English when the time comes to be with other children, to be in school. And that is, in fact, beyond me, beyond any adult. It's the superpower, and that one of the reasons we want the child to be in your lap, hearing your stories and your songs and looking at the book together, is that is helping the child develop that amazing brain and that amazing language ability.
Yeah, I definitely, I love telling parents, if your baby is learning language when they're this age, newborn, 2 month, 4 month, their brain is going to is developing differently than me learning the language at this age. And I talk about the research and how the research shows that depending on the age at which you learn the language, your brain develops differently. And the language centers of your brain develop differently. And if learning a language at an earlier age is easier, you have more, the architecture of your brain looks different depending on when you learn it. Going back to studies that were done on brain development and when kids were exposed to languages. And I think it's really powerful to explain that. Take the time and say, if your baby's learning your language from infancy, right, you're getting such an advantage. So don't wait, do it from birth. As long as you can speak the language well. I think for me, seeing those, I think they were functional MRIs or pictures of the brain and the different centers that would light up on the studies with babies who were learning Japanese, from 6 months versus 3 years versus 13. I said, I wish I had that with more languages, that I had learned them as an infant. So I think just reiterating that for parents is really, really important. I also, Nikki, see there was a question in the chat. I don't know if it's okay if I just comment on it on a different note. So there was a question from Fortunata about other members of the interdisciplinary team engaging with families in the books versus just the MDs. I think in an ideal world, we want our practices to be a literacy-rich environment where from the minute you walk in the door through, till the minute you leave, there's literacy, there is relational health everywhere. So ideally, if you have books in the waiting room, if you have volunteers in the waiting room who can model reading aloud for families, I think that's amazing. I know when COVID hit, a lot of places had to take out the books. I know we've gotten them back. A lot of volunteers, there were changes, but I think if you can have volunteers, you can have a literacy-rich environment, whether it's with books, whether it's with posters. We have sort of on our walls, we have information about how sort of in the decor, information about things that parents can do with children to promote their development. I think that's amazing. And I will tell you that doing trainings and incorporating all members of the interdisciplinary team from the front desk to our MAs, to our nurses, is really important, because if, God forbid, one of my doctors does not give out a book to a family, I will have the front desk people coming back. And when the mom is going to make an appointment, the next appointment, and she says, I didn't get a book, that front desk colleague of mine will come to the back and say, Leora, they didn't get a book. Oh my God, which one? And I'm like, my first question is, okay, how old? What do we want to give them? And then I'm like, okay, who didn't give them the book? But we have that on all levels, whether it's the front desk, it's the MAs, or I'll have an MA saying, you know what, that family, they were waiting a long time. They had to get a blood draw. We had to repeat it. Could we give them an extra book? So I think for sure, to the extent that we can incorporate all members of the team into our program and our messaging, it just enhances, and it sort of supplements. It kind of just has this exponential impact. I think when everyone is on the same page and everyone feels that it's their program and they want to make it succeed.
So I have to say to you, I was coming down in the elevator at Bellevue yesterday from clinic, and as always, the elevator was quite crowded, and there was a child coming out of clinic in a stroller in the middle of the elevator with her mom, and she was a very adorable under 1-year-old girl who happened to have a bright pink book that matched her outfit. And everybody in the elevator, either directly in language or, non-verbally, commented to the mother on, cute baby, book, how great, matches her outfit. And there were at least 3 languages going, but it was clearly whatever she may have heard at the checkup and whatever issues there may have been to discuss. I think that she came out of the elevator feeling that people had really admired her adorable baby, who was adorably holding a book, which, clearly she was happy to take home. I think people who, we all know this, people who work in pediatric clinics, we tend to flirt with babies. on the subway, on an airplane, in a waiting room. We tend to be the ones making faces at the baby or waving when the child goes by in the stroller and happens to wave at you. And I think, again, it's something we can build on, the power of the nonverbal connection. And it's not something that's always discussed, say in residency training, the question of, your body language, where are you looking? I mean, we just to say one more word about residents, we put them in a very difficult position. They're expected to be in communication with a screen, checking things off. And then if you have an interpreter who's also on a screen, there's a second screen in the exam room where there's the interpreter who you're trying to have engaged in the conversation. And I think anything we can do to model and encourage that direct connection with the family, with the baby, and using body language and not having it be you talking to your screen and now your screens, I think that's very helpful. And again, it's something where it helps if there's reinforcement and approval from the people doing the teaching.
I knew this conversation. Oh, go ahead, Claudia.
I just have one more thing, because I always feel like if there's a day I don't mention the word library, I'm not doing my job. So I think another thing that we can all do with our families, regardless of where they come from, is talk to them about the library. Let them know about our wonderful public library systems, and let them know that at the library they can have access to even more books in their languages, that if their library doesn't have it, they can request it to have it delivered, that at the library they can have classes and events for mom and dad and the other children, that they have a story time for the baby, and that's another way in which they can socialize with other babies and moms can meet other moms in their community. Because I think we want to also be able to establish a link between the medical community, but extended to their own local community, so that they feel supported not only in the exam room, but they also have other forms of support in their neighborhoods and wherever they're coming from. And it might take a little bit of encouragement. So I would say maybe the first time you mention it and say, did you have a chance to go to the library? Did you check it out? Did your baby get a library card? And then the next time you see them is another way of establishing that connection beyond just the medical needs of the child, but showing the family that you definitely care about them and want to be able to serve them in different ways and offering different forms of support. So the library is one that I always mention to my families, especially when it comes to helping them figure out ways to have access to books and other materials in their own languages.
I was going to say, I knew that I wasn't going to need to say much during this because you're taking it away and doing well there. And the chat there's a few things in the chat. I just want to make a comment that our Read, Chat and Read friend, Dave Reisman, who's the author of the Cows Can't series, is asking about what languages should we put in books in. So thank you for asking that question. And I see you're getting lots of answers there. Please do put any questions or thoughts, add to this conversation in the chat as we go along. Just for the last sort of 15 minutes and including questions from the audience. The last section of the directive of the one pager is it's about using Reach Out and Read books as conversation starters to promote early relational health. And I'm going to quote, during our preparation time, one of the things that was said was, the value of Reach Out and Read is deeply relational. And I think we've been talking already about how that, the book can help you create the relationship with the family so that you can have this kind of non-language connection, as it were. But I wonder if you'd like to continue that. You've talked already about so many of the things that you've already said on there, but just talking about that book as a promotion of relationships within the exam room, as well as relationships when the family gets home together, just to kind of riff on that a little bit more.
Yeah, I mean, I can kick it off. I think we've talked about, our role modeling and speaking with parents about the role of books. I think giving families concrete, depending on the age of the child, and that's where I think that tool that we alluded to before will be really helpful. But I like to give parents, some pretty concrete suggestions. So using the books as sort of the cornerstone of routines, right? So whether it's nap time, bedtime, right? Having a book or a story as a way to incorporate that warm, snuggly feeling. You're reading a book, you're talking to your child, you're telling them a story. It's before you put them down for a nap or before they're going to bed. I think that's one example. And if you want a specific example of how you can use books to promote relational health, that's one. And also use it to promote routines, consistency. We know how important, right, routines are in a baby's life, in a child's life. Consistency, knowing sort of what comes next. So using the book as part of that routine, I think, is really important. And again, different cultures, it may not be part of your culture. So I like having that as a tool. I think another example, I always say to families, using the books to help families get a deeper understanding of sort of what is, I don't say normal, but typical or acceptable normal development versus not. When you think about an 18, 20, 24-month-old, and they're really trying to assert their independence, and they're really trying to make decisions, but they really can't make decisions, I'll always tell the parent, the book can be a way for your child to assert their independence. You may be, pulling your hair out because you do not want to read Where the Wild Things Are 75 more times. But if that's what your child wants to do, and that's how, a 2-year-old can assert their independence, where they read it, how they read it, standing on their head, that's fine. And that's something you can do as a parent to bond with your child, to give them that sense of control. And it also gives the parent, I think, a deeper understanding of what's normal at different ages, right? Setting expectations, appreciating, that about their child. I've had parents say to me like, wow, I really appreciate how determined my child is. You made me, there's a way of taking behavior and turning it from really annoying or like, what, just listen to me, into, wow, my child is determined. My child is, perseveres. They want to read that book 27 times. That's not stubbornness. That's not listening. That's perseverance. It's determination. It's grit. There are all these different ways that we can relabel, I think, behaviors and interactions and find the positive in them. And I love using books as part of that. So I don't know if that answered the question so much, but those are just some of the concrete examples that I give. And then I'll just throw in one more. I think especially in the first few months of life, moms particularly, and dads too, are exhausted, are tired. They don't always, or I can say from my own example, I didn't always have the language and the words. I was tired, I was exhausted. And especially when you have, more children and you're trying to deal with everyone else, and perhaps you're working too. So it gets really, really hectic and crazy. And I'll tell parents, we know how exhausted you are. We know how tired. Sometimes you just don't have the words. You don't have the vocabulary. Here's a book. This will give you something to talk about, words to rely on when you yourself really can barely get the words out of your mouth. And that's when I love, and Mariana's not on the panel, so I can do this, I can promote her book, but at the newborn visit, we give out a book that Mariana Guzman co-wrote, I Love You Like Sunshine. And it's a paperback book, it's not a board book. And one of the things I love about it is that when a mom or a dad is exhausted in those first few weeks, it gives you a vocabulary, it gives you a picture of pictures of parents with their babies. And it has, on the sidebar, things that you can do with your baby. It has advice, but whether it's that book or it's another book, it's giving you the words and the rhymes and the stories to tell your baby so that you can cuddle with them, you can connect with them so that they hear your voice. They already know your voice. The moment they're born, they recognize your voice. So this is just giving you that vocabulary when you really are just too tired to make it up on your own.
Thank you, Leora. There's a question comes through is what's a good way to share this one pager with clinical teams so it feels useful and easy to incorporate into well-child visit?
So I'm hoping that some of what we've said, both in terms of feeling wanting to do a good job, wanting to do a better job, wanting to help residents feel more comfortable and do a better job, will resonate with other people, and that I'm hoping that's a question that in part you will help us answer. What's helpful, what's useful. I would I have wanted repeatedly to kind of have this conversation with the colleagues I precept with the residents in the clinic, especially in recent times when it seems like many of the families that we see are new in the city, new in the country. You know, what seems to work? I I have thoughts, but I don't have a prescription, and I'd be really curious to hear what works. Does it work to do it at whatever kind of more or less formal residency clinic conferences you have with the residents? Would it make sense to do at a clinic staff meeting? But I think it's a question of, as you think about your setup, where do you think it might be helpful to, would it help to have one medical champion bring it in and, talk it through? What do you think, Claudia, Leora?
I'm thinking that intern orientation, so I think it depends on your program and when you orient your clinicians and residents, particularly to reach out and read. So and again, we do a training every year. We also do some exposure during our intern orientation in June before the interns start. And then during our ambulatory outpatient block, I stick in an additional reach out and read, like the national online training. So I think this could be incorporated into a lot of those, any of those sort of encounters. I think it depends on the setup of the program. I am always happy to speak with people who are either responsible for resident education surrounding Reach Out and Read to kind of think about how do you optimize it for this topic and for other topics also, but how do you optimize it? How can we work this in there? I think having the one pager, I mean, honestly, like I plan to have it laminated, have it on the wall. I think having it around will also increase its uptake. And for me personally at Sinai, I plan to introduce it during intern orientation. And then when I have the residents on their 2-week, like their first ambulatory outpatient block, we'll get it in there, and then it'll be part of our training. So I think repeated doses, I hope we'll see a dose response, reaction. The more we expose you to it, the more you use it. But I think, and I would also encourage programs to think sort of more broadly, like what are all the components that you want your residents to get, right? And what are the layering on that we're talking about? The books as a clinical tool. We're talking about particularly interacting with families, different languages. Like, how do we put this all into one holistic package, and how do we reinforce it? For this particularly, I think reinforcing it, having it there in your preceptor room, remembering to talk about it, I think is really important.
Thank you. Do you have anything to add, Claudia?
Basically, that's what I was going to say, that I think the more consistent we can be with the messaging, having it in different dosages and in different places, in the way I would even have it in different areas of not only the exam room, but wherever the medical team might be exposed to. But also having even using it as a starting talking point with our colleagues, right? What works for you? What have you done? because we want to be able to learn from each other as well. It's not that I think people respond better when you open up the conversation in a way that engages them instead of saying, here is what you should do. The same way we're talking about parents, right? In which if we open it up to the medical community, in which we're providing some tips, we're providing some ideas, but we're also welcoming ideas. And in that sense, I would welcome everybody here that if you have some strategies that have worked for you, share it with all of us. Send, those tips to the whole team for Reach and Read of Greater New York so that they can communicate it to us and we can see how that might be able to also enrich this document that is still a living document. And we can all learn from each other in this beautiful journey that we have as a Reach Out and Read family, trying to support all of our families.
Thank you, Claudia. And on that, I just want to thank Perri and Leora and Claudia for coming and giving us their time, telling us about this new document, which again, it will be sent out with the materials after the conference. And hopefully you'll be able to use it. And as Claudia said, kind of keep the conversation going as to how Reach Out and Read can help support this kind of work. So with that, I'm going to hand you all back to Jessie.